Hi, today I am going to discuss about the optic nerve. Optic nerve is the second cranial nerve and it is sensory. And it is the sensory nerve. I discussed in the past the sensory cranial nerves are 1, 2 and 8. 1 is olfactory, 2 is optic and 8 is auditory. Okay. Optic nerve is second cranial nerve and it is sensory nerve. Okay. Let's come. Imagine this is an eye and this is an eye. Okay. An eye is helped to see the particles around us. Okay. Imagine this eye and this is the visual field. At the range we can see everything, and this is our nose. Just imagine this is our nose and these are two eyes of us, and this is also the visual field. Okay, just imagine here the nose is present, so this part is called as nasal and this part is called as temporal, and this part also called as temporal. Okay, then I am going to tell you the field of the view of the nasal and the temporal fibers. Okay, optic nerve has mainly two fibers, temporal fiber and nasal fiber, and this is the field of the view. Okay, this is the field of the view. These are also emerging, but in this video I am just going this to differentiated part, the different part, because it has a logic. Okay, this vision is nasal vision and this vision is temporal vision, because it is present side the nasal, so it is nasal vision and it is temporal vision. This is also temporal vision and nasal vision. Okay, optic nerve has two fibers. Okay, this is a rough diagram. I am just trying to understand all of you. Nasal vision and temporal vision, and this is temporal vision and nasal vision, because this is the nose, that's the nose is present. Okay, this is the nasal fiber of optic nerve and this is the temporal fiber of optic nerve. Be careful. The nasal fiber of the optic nerve is responsible for the seeing the temporal vision or the temporal vision of field. Just imagine, the nasal fiber of optic nerve is responsible for the temporal vision field. Okay, this is the total vision field or field of vision. Okay, and nasal fiber is responsible for temporal field of vision and temporal fiber is responsible for the nasal field of vision. This is here also same case, nasal fiber, temporal fiber. Nasal fiber is responsible for seeing the temporal vision and temporal is responsible for seeing the nasal field of vision. These temporal fiber come down straight away, little bit straight away, but the nasal fiber does not come straight away as such like temporal fiber. They change their path. I mean, I am saying that the right nasal fiber goes to the left side and the left nasal fiber goes to the right side, but temporal fiber doesn't change their way. Okay, this is called as optic chiasm. Okay, this structure, this is temporal fiber. Temporal fiber of the optic nerve does not change their way, they come down little bit straight away, but the nasal fibers change their way or path. I am just trying to say right nasal fiber change their path and goes to the left, and left nasal fiber change their path and goes to the right, and the X like structure is the crossing over like X like structure is called as optic chiasm. Okay, this is the main anatomy and little bit of physiology. This is also anatomy because this part how it is coming, this is also anatomy. Somebody says or thinks that it is all of the physiology, but no, this is also anatomical part because these fibers are where present. This is the nose, this is the nasal fiber. Here a little bit of physiology is coming. Nasal fiber is responsible for seeing the temporal, and the temporal is responsible for seeing the nasal field of vision. Okay, now come to this diagram. This and this the left eye, this the right eye. I am not going to discuss or recap the previous path, how left is coming, how right is coming. Okay, I am now just going to say that the main structures. Okay, this is the temporal fiber come down straight away, this the temporal fiber come on straight away, but the nasal fiber change their path. Right nasal goes to the left side and left nasal fiber goes to the right side, and this X like structure is optic okay. This nucleus is called as lateral geniculate nucleus. Okay, this nucleus and this nucleus are called as lateral geniculate nucleus, and these are the optic radiations. Okay, and all of this radiation goes to the occipital lobe of the brain. Occipital lobe, in where of the occipital lobe? The main visual center or the primary visual cortex. That goes to the primary visual cortex in occipital lobe. Okay, thank you.